Hi everyone, it's Dr. Brittany Todd. I'm a pharmacist and a mother, and recently I have been digging into immunizations and vaccinations. When I was in pharmacy school, they taught us the CDC schedule. They taught us, polio is gone because of the polio vaccine and smallpox is gone because of the smallpox vaccine. And I'm here to tell you that there is so much we just did not learn that physicians, pharmacists, PAs, nurses, nurse practitioners are not taught in school or in practice, really. I mean, think about it. There's only so much time to learn about a certain topic in school. And then once you're out of school, you're just go, 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 right? If you're a physician, you're in fellowship or residency, and you're just go, go, go. And who has time when you're taking care of 15, 20, 30 patients a day to actually look at the data? And you didn't have time in school because you had everything to learn that you're not going to look at the actual data. So I was that person, and I have to admit this. I was the person when someone said, I'm not getting a flu shot. I think it made me really sick the one time I got it. I was the pharmacist that said, that's ridiculous. It's an inactivated flu virus. You're not going to get the flu from it. Just get the flu shot. It decreases mortality if you've had heart disease, cardiovascular disease. I was all for it. Did I actually look at the data? Of course not. I didn't have time. I had 20 patients a day that I was taking care of, and different lists and patient activities I was doing all day. I didn't have time for that. And then when people questioned me about it, I just simply said, well, I'm the expert because I know better. Pharmacy school taught me that you have to get immunizations, and practice guidelines and CDC guidelines tell me that you need to get these immunizations. So I vaccinated my daughter, who is now 10. She got all of her immunizations up through age 5. And then after that, it's a different story. And I actually don't think I would have ever changed my mind, because I wouldn't have even known to change my mind on immunizations until recently. And what I mean by that is COVID overplayed their hands. So when COVID happened, at first I was kind of freaked out, right? People were dying in China, people were dying in Italy. We were seeing these horrific news stories and like phantom empty streets and people crying and wailing and people dying in the streets. And it was awful. I was scared. And that was for about 2 weeks. And we were in that full lockdown, stop the spread, stay home. And then after about a month or two, I was like, why are we still doing this? We're stopping the spread or slowing the spread, but we're still at home. And when are we going to get back to normal? And then you started hearing things like, oh, well, we'll only get back to normal when we get vaccines. And I started talking to my pharmacist and nurse practitioner friends and some physician friends. And I thought, well, that means that we're not going to get back to normal for like 5 years, because it takes 5 years minimum to get vaccines. And this is a brand new virus and a brand new technology that they're talking about with these mRNA vaccines, that they would have to start from scratch. It's not even starting with like what we already know and then building from there. It was like, we don't even know. We know nothing about this virus. We know nothing about these vaccines, this new technology. And I thought, oh, great, it's going to take 5 years for everyone to get back to normal. At this point, we just need to start getting back to normal. And then in November, they said, oh, we just finished a 12-week study on this brand new technology COVID vaccine. It was the Pfizer trial. And I thought, as a pharmacist, I thought, 12 weeks? 12 weeks? What are you talking about? So I started doing the research into this mRNA technology, and people kept saying, well, actually, we had this mRNA technology in the past. We've used it for other vaccines in animals. So it's been studied in animals, but it hasn't been studied in humans. So we at least had like these other early phase trials leading up to the use of the mRNA. The problem is, when you looked up those trials, the mRNA vaccines killed more mice and rats than it did saving them. It was not pretty. Like the mRNA technology that we had used in the past and with other animals and vaccines and different viruses was not safe, and it caused significant harm. It actually upregulated the immune system so much that it started attacking itself. So that was not good data leading into it. And then we just started giving it to people in these trials. The other problem with the trial is it was only 12 weeks. So you can't get any long-term data from 12 weeks. I mean, literally every other study that I've seen is at least 2-3 years. That's like, cardiac drug, new, chemo drug. I mean, we don't do 12 weeks. 12 weeks means nothing in the grand scheme of things. That's 3 months. That's crazy. The problem with the study is not only did they give half of the people the vaccine for 12 weeks and the other half got placebo, but after the 12 weeks, they gave all of the placebo people the vaccine. So we no longer had any opportunity to realize if there was any long-term consequences of these vaccines. And we know from the animal studies that there are. These animals developed basically autoimmune attacking, body attacking disease. And they died more than they didn't. So they basically wiped out the placebo group. So we didn't have a comparator group, which is not good medicine. So fast forward, to December. So a month later, they start giving it out to the public. And in December, I thought, who would be the first ones to get this vaccine? It literally has been studied for 12 weeks. We don't even have the study in front of us. We can't even read the data. It's that new that they hadn't even published it yet. The only people who knew about it was the CDC and the FDA and the pharmaceutical company, Pfizer. And they said, it works, let's do it, get it out to everybody. So there were people in December who were getting these vaccines. And then, they started spreading it in January, February. Okay, now, the older people should be getting it. And then they kind of, eventually allowed everyone to get this vaccine. And that's what got my brain going. That's what got my brain going, wait, it took 12 weeks of information and no long-term study data to decide that the entire world should get this vaccine. There were no contraindications to it. Everybody should be getting this vaccine, and I want you to get it now. And I thought, wait a second, is this how we study other drugs or vaccines? And I've seen studies on, beta blockers and statins and new therapies, and I've never seen anything done in 12 weeks and then just completely pushed out on the public. And that really frightened me. Thankfully, at the time, I wasn't working, so I didn't have the pressure of the job saying you have to get these vaccines or you lose your job. My husband, however, was working. I'm very grateful that he worked for a place that did not require the vaccine, because he was like me, and he's like, I'm not taking something that's been studied for 12 weeks. I understand COVID is scary, but COVID really didn't have as high of a mortality rate as we were led to believe, and we know that now. And usually if you're healthy younger like we are, we weren't at risk, and our kids weren't at risk. The vaccines never were proven to decrease transmission of the virus. So us getting the vaccine didn't help my grandma not get COVID. So it didn't seem like the right thing for us, especially with the information we had. It just was so minimal. I also was nursing a baby at the time, so I didn't want to take anything in my body that could possibly get into the breast milk. And then, 2 months later, the American College of Obstetrics and Gynecology was saying every pregnant and breastfeeding woman should take this vaccine. It's not even studied in these people. I've never in my life seen any medicine given to pregnant or breastfeeding women that wasn't proven safe, or, from like decades or centuries of knowing that this is reasonably safe. I've never seen them just give pregnant and breastfeeding women new medicines. So the 12 weeks of COVID vaccine experiments, mixed with the fact that it literally went out to everybody, so we have no idea what the placebo versus the medication safety profile is. And then they were saying kids, no data. Pregnancy, breastfeeding, no data. Everyone should get it. And then it started, it made me go, wait, is this just a COVID thing? Or is this an everything thing? And that's when I started looking into other vaccines. And slowly I went from, okay, we're not going to do the COVID vaccine, but we're still vaccinating for everything else. So I got my, at the time, 6-month-old baby her flu shots and her normal 6-month shots, right? Her Hep B, her polio, all the things that you get at your normal 6 months. But then at a year, when the COVID vaccine was being studied and being rolled out, I was like, something's wrong. And I'm going to put a pause on these vaccines. It doesn't mean that I'm not going to immunize my kiddo. It just means I'm going to look into it more, because what happened with COVID was insane. And I was not giving my children the COVID shot. So that's when I started peeling the layers. And I feel like the first few shots that went for me was the measles, mumps, rubella, and the varicella. And really that was for me an ethical issue along with the COVID vaccine. The ethical issue with those is that they are made from aborted fetal tissue. So they actually use an aborted baby from the 1970s. They use their tissue and they continue to create these vaccines from that original tissue. And ethically, as a Catholic, we don't believe in abortion. We believe in the sanctity of life. I didn't feel comfortable ethically giving my child an MMR and a varicella. But I was still in this thought of like, well, if there was an ethical varicella shot, the chickenpox shot, then sure, I'll give that, right? So I was peeling back the layers. COVID went, MMR and varicella went. And then slowly, over time, I started losing more vaccines. Another really big one came up when I got pregnant again with my third child, and he was born in July 2021, and they wanted to give him the hepatitis B vaccine. Of course, I mean, every child in the hospital gets a Hep B vaccine and the vitamin K shot, and our first two got it. And we started questioning things, and my husband said, well, why are we giving a newborn who's just like 2 hours old is when they do it? They're like 2-3 hours old. Why are we giving a newborn the hepatitis B vaccine when they're not at risk for hepatitis B? And Hep B is a sexually transmitted disease or from IV drug use, neither of which are risk factors for my baby, my newborn. I don't have it. My husband doesn't have it. And we don't use IV drugs. Like, what do they think our baby's going to be doing when they're 6 months old? So we said no to the Hep B vaccine. They can get that when they're older. There's no reason to give a child a Hep B vaccine at birth, except because the pharmaceutical companies, instead of giving it to people who are at risk, like IV drug users or people at risk for STDs, that's a very small population. They make more money if they can give it to everyone. So they just give it to everyone. And to be fair, when it first came out, I think the reason they did it is because there were people back then that had Hep B and didn't even know they had Hep B. But nowadays we do tests. And I'm vaccinated. Like, we were all vaccinated. I don't have Hep B. My husband doesn't have Hep B. We all know we don't. So there's no reason to give a Hep B vaccine to someone who doesn't even have Hep B or is even at risk for Hep B. That makes no sense. So that one dropped immediately. And that to me is like an easy one for most new parents when they're in the hospital to say, I don't want that. Why would I do that? And a lot of nurses and physicians are like, of course you have to do it. The CDC says you have to do it. But if you ask them and say, well, are they at risk? They would say, no. They might be in 20 years. Okay, let's give it to them when they're 20, not a newborn with a new body and a new immune system. It makes no sense. So that one dropped. And then I started looking into the Tdap when I was pregnant with my third, because you get a Tdap, which is the tetanus, diphtheria, and pertussis vaccine. You get that every time you're pregnant. And the reason for that is the pertussis vaccine doesn't last very long. It actually starts tapering off after about a year or two. So if you get pregnant every year, 2, 3 years, you're supposed to get a new pertussis booster so that when you have the baby, your pertussis antibodies are higher. So that's what I did with my first 2 pregnancies. But again, with my third, after COVID happened, I thought, do I actually need this pertussis vaccine? I just had one a year and a half ago. And looking into that, I started realizing I don't want pertussis. Not only do I not want pertussis, because it's actually healthier to get natural wild type pertussis, because if you're ever exposed again, you don't colonize with that pertussis anymore. So if I ever get exposed to pertussis, my lungs won't colonize. I'm immune because it's a one-time disease as long as you're exposed every once in a while, which we all usually are. You don't colonize with the pertussis bacteria and then cough it off. But if you're immunized, you can still be colonized but be asymptomatic, which means you could be hanging out with your baby, or someone else who was immunized for pertussis could be hanging out with your baby, actually have pertussis bacteria in their lungs and not even know it because they're asymptomatic, because they're fine. They got the vaccine. But now they're breathing and smooching and touching your baby, and they could possibly have pertussis. So I was like, no pertussis. I want the wild type, the right kind of pertussis antibodies for my baby. So if I do get pertussis, I don't get colonized with it and I don't pass it on to my baby. So then I started thinking, well, if I don't want pertussis, what about tetanus? Should I just get the tetanus every 10 years? Well, it turns out tetanus is only a bacteria found in sheep and cow manure in the dirt. So and then you have to cut yourself open with something and then infect it with that yucky dirt. So usually the people who get tetanus work on farms. They were digging in the field and they got cut with a nail or something. And then of course they have manure and, animal feces on their farm. So that can infect it and cause tetanus. That's the tetanus bacteria. So if you're not at risk for that, like you step on a nail that fell off your roof, like my husband did, the roof doesn't have dirt. It was a clean nail at one time. Yeah, it's rusty now, but it wasn't in dirt when he stepped on it. He's actually not at risk for tetanus. But he freaked out, went and got a tetanus shot. The problem is you can't just get a tetanus shot anymore. You can, they're available. It's very hard to find them. But they are connected with the diphtheria pertussis. Like it's all in one, and it's like if you step on a nail today, you get Tdap. If you step on a nail in 2 years, you get another Tdap. Like you keep getting these same immunizations over and over again, but you don't need it. You don't need diphtheria. We don't have diphtheria here anymore because we have clean sanitary water. So out of the three triple, the Tdap, the tetanus, diphtheria, pertussis, diphtheria is not even a thing anymore because we have clean sanitary water and sewer systems. We don't have diphtheria anymore. Tetanus is only a risk if you're like at a place where you've got manure and you're worried about it. And then pertussis, it's actually better to get pertussis at some point early in life, and then you're just immune to it. It's kind of like chickenpox. Like you get it once and then you're immune to it. I get it's dangerous for little kids, especially babies. I get that. But we also have better treatments than we did 120 years ago when kids were dying of pertussis. We just don't have that. In fact, if you look at the graph of pertussis deaths, before the vaccine came out, there was like a 98% drop in pertussis deaths before we even had a pertussis vaccine. So it was on its way out anyway, probably because we had better medicine, better sanitation, better sewage, better health, better nutrition, right? We have all the things. So I have now lost COVID, MMR, varicella, Hep B, Tdap. And I thought, man, I'm down to like polio. Okay, polio. Polio is still a thing, right? We still have polio, but not so much here. But maybe if I go to India where they have polio, or China where they still have polio, maybe I would get the polio vaccine. But I don't think my kid needs it right now because we don't have polio here. And then I started looking into that one. And guess what? Well, polio was not really a disease until like the 19th, 20th century. Did you know that we are all colonized in our gut with the polio bacteria? And it's normal, but it didn't start causing problems until the 19th, 20th century when we started using something called DDT. It is I can't think of the word. It's used on farms to get rid of the bugs, right? I don't know why I can't think of the word. But we used it not just on farms, but at the time in like the 1900s, because of bugs and flies, we know they spread disease. People were literally spraying pesticide. That's the word. They were literally spraying pesticide, DDT, on their bed linens, their food, their tables, and they were told it's totally safe. It paralyzes the bugs, but it doesn't paralyze people. But what's polio? It's paralysis. And like 95% of people who get polio are asymptomatic, by the way. There's only about 5% that get some symptoms, and then a very small percentage of that actually get bulbar polio, which is like the really bad, paralyzed, could kill you polio, right? And what they found is most people who got that polio were along the farm belt, and it's because that's where they were using DDT the most. They were spraying their cattle so they didn't get bugs. They weren't just spraying the cattle, they were like having the cows swim through a DDT bath so that they'd get DDT all over them and then they wouldn't have bugs. And then the kids would play with the cows, and then all of a sudden they're like, wow, 4 out of the 5 kids in the so-and-so family in Oklahoma have polio. It must be super contagious. But I don't think it was necessarily contagious. I think it was the fact that they were hanging out with the DDT cows and got paralysis. The other thing is, after the polio vaccine came out, they changed the definition of polio. So before the vaccine came out, before anyone was immunized, any paralytic disease was diagnosed as polio. They didn't look into what it was. They just said everything's polio. You have Bell's palsy. Now we would call it Bell's palsy, where you get like paralysis of the one side of your face. If you have transverse myelitis, which is a paralysis, if you get Guillain-Barré syndrome, any of those would have been diagnosed as polio. But when the polio vaccine came out, they said, you know what? No, it's not polio. Look into it. And so they started looking into it. And they'd rule out polio because they can do a test for it, a culture for it, and find out it's not polio. If they had done that before, they probably would have found out all of those weren't polio either. And then that's when you started getting transverse myelitis and Guillain-Barré syndrome and Bell's palsy and all these other like paralytic diseases that still occur. Did you know transverse myelitis? I heard somewhere that there's 1,300 cases of transverse myelitis a month in America. Think about if those were diagnosed as polio. We'd still think we had an endemic of polio here in the United States, but we don't, because we changed the definition. So we stopped using DDT and we changed the definition. So those who would have been diagnosed with polio are not being diagnosed with polio, and we got rid of the major risk factor that causes polio. So get this, in India and in China, where we say, okay, if you're traveling there, maybe you should get the polio vaccine. Well, the reason they still have endemics of polio in those places is because they still use DDT. They actually have a higher vaccination rate in India. 95% of their population, because they start as babies, are immunized for polio. Yet they are still getting polio. And it's because they still use DDT in those countries. So that right there shows you that the vaccine didn't really do anything. It's just we changed safety standards and definitions. So polio is now out for me, and that left me with the flu shot. I mean, I feel like I pretty much knocked out almost every single shot. I mean, pneumococcal, flu, H influenza. And when I got to those, at this point, I'm like, what are we doing? So the flu shot decreases your risk of getting the flu, but it only depends on what strain of flu makes it to the United States. We kind of guess. We look at the Eastern Hemisphere and we say, okay, it looks like the flu over there is like influenza A, right? So we're going to make the flu shot over here that same strain, right? H2N1 or whatever, right? And we'll make it the same strain over here. And that's kind of hit or miss. Sometimes we completely miss the mark and we have a worse flu season. So it does decrease your risk of the flu if you have the right strain. It also seems to reduce the severity of the flu if you do get the flu. However, it has been shown to increase your risk of other respiratory infections, colds, pneumonia, other flus that are not covered. So it's actually kind of a wash. You might not get the flu, that strain, but you will get other things because it actually causes more of an immunocompromised respiratory system. So people who get the flu shot, they've been shown to have more respiratory illness than those who didn't get the flu shot. So that one was gone. Pneumococcal, I haven't looked too much into. H influenza, I haven't looked too much into. But again, I'm kind of at this point where I'm like, out of the, 12 vaccines out there, I'm done. I'm done. I mean, I don't know what the risk for Haemophilus influenza is. Not very high. I don't know too many people who have ever had H flu. And then pneumococcal, but pneumococcal pneumonia is treatable. So if you get pneumonia, and most people don't get the pneumococcal vaccine. We don't just give it to everybody. It's if you're at risk, right? You're older. We do give it to littles. But the in-betweens, like teens, 20s, 30s, we don't do it anymore. And people can still get pneumonia. So we have treatment for pneumonia. So I'm kind of at the point where if there is a reasonable treatment for something, why am I preventing what I might not even get? And it has side effects. There are side effects to everything. So these immunizations can have side effects too. And I might not ever get H flu. So why do I need the H flu vaccine, right? And then if I do get H flu, it's treatable. I can do something about it. So that's kind of where I am with those vaccines. The other one that I wanted to talk about is Gardasil. That's the HPV vaccine that is supposedly supposed to decrease your risk of cervical cancer because the virus can cause some of the viruses can cause cervical cancer, but there's hundreds of different herpes viruses that can cause, or human papillomavirus, sorry, that can cause cervical cancer. And this one only covers a very small amount of them, and the other ones are still there. So it doesn't completely eliminate. In fact, there's no studies that show that it actually decreased mortality from cervical cancer. And there's significant side effects with Gardasil. Infertility is a huge issue with Gardasil, and passing out. Girls who get Gardasil very often pass out. And that to me seems like a cardiac related issue, and I don't want anything to do with it. The other thing is, again, it's one of those things that you're taking a vaccine that has side effect potential, and you may not ever be exposed to it, right? Like if you find out that your husband to be doesn't have HPV, then you don't need it. It's one less thing you need in your body. Now, I can see there's certain vaccines like Gardasil or Hep B where if you're at risk for it, you find out your husband has it or your groom to be has it, then yeah, you might be someone who may consider getting it. But the fact that we're just giving everyone it because we're just assuming that everyone's going to be promiscuous and have, this risk is crazy to me. The other vaccine, the last one that I need to do more research on is the rabies vaccine. So the rabies shot is one of those vaccines where it's not really a preventative unless you're a vet, right? Unless you're like super high risk. Again, like Hep B, if you're high risk, maybe the benefit of the vaccine or immunization outweighs the risk. But the rest of the population, we don't get the rabies vaccine unless we're exposed or possibly exposed to rabies. So that to me makes sense. If you're going to use a medication, an immunization, because you're at risk for something, then yeah, the benefits may outweigh the risk. But if you're not even at risk for something, how could the benefits outweigh the risk? So that's where I have come like full circle on immunizations. I used to be pro immunizations, give my kid everything I can, telling people if they don't get immunized, they're crazy. And now I've opened my mind. Really, it's not that I've done anything drastic. I've just looked into it and turned my brain on and said, well, why does the CDC recommend a Hep B in a newborn as opposed to a 25-year-old or an 18-year-old or whoever would be at risk, right? And that's when I started thinking, what is the actual agenda here behind these vaccines? And really, I think it ultimately comes down to money, right? The more people you immunize, the more money these companies make. And we all know that there's kickbacks to the FDA and the CDC. We just found that out with COVID. So that's where I am with vaccines. Complete 180. I wouldn't say that I'm anti-vax. I would say that I am pro-facts. And that didn't mean to sound poetic or weird or anything, but I just want to know the actual information. And the more I look into it, the more I'm just shocked at what is out there when it comes to all of these immunizations. One resource that I do want to recommend for those of you who are interested is a book called Dissolving Illusions by Dr. Suzanne Humphreys. She wrote just an amazing book about vaccines in general. And she basically starts the book with what diseases were prevalent throughout the centuries and why. Where did they come from? You've got a lot of diseases that came from poor sanitation and poor ventilation because people lived in slums, and they didn't eat well. They had horrible nutrition. Their bodies were not nourished and healthy, and they worked 15 hours a day, and they lost their mom when they were little, so they had poor nutrition because their mom was gone. Just all these horrible things. So she starts with just like the environment that caused the problem, and then how that shifted into better sanitation, better practices, better medications. And then she gets into the vaccines. And then each one she kind of topples out, right? Like, here's smallpox. What was smallpox? How was the smallpox inoculation developed? How did it improve health in a society or in the world? And then she goes into polio, and she goes into measles, and then she goes into just a bunch of different vaccines, right? I think it's a fantastic book. And she was similar to me, she said. She started out, she's a nephrologist, and she used to work in a hospital for years, and she was very pro-vaccine. And then one week, I think what I read is 1 week, and within a week, she had 3 young people come in with acute kidney failure. Like, their kidneys just died, right? And she was like, that's really weird. It's incredibly rare for a young person to have kidney failure, let alone 3. And all 3 of them said, I just got my flu shot last week or 2 days ago. And she was like, that, the first one, she was like, not related, right? Second one, she was like, that's weird. That's what the other guy told me. By the third one, she was like, oh, I need to look into this. And that's when she opened her eyes, because she looked into it. We just don't have time as providers to look into every single drug and every single thing, right? I can't possibly look that up. I don't have the time. But because COVID opened my eyes, I made the time for immunizations. So I encourage you to read Dissolving Illusions. I encourage you to do your own research and make your own decisions for your own children. Thank you for listening. If you liked this, like and subscribe to my channel. I'm a pharmacist, and I like to give a lot of information about medications, about disease states, how to treat kids, how to treat pregnancy, how to treat adults, all sorts of things. And if you ever have any recommendations or questions about medicines, write it in the comments. I am happy to do a video on something else as well. So like, subscribe, and thanks for watching.